Let's see, we're going to call to order and roll call. I see that we have a quorum just based on the smiling faces. Let's get to the school reopening.
Okay. So, well, we got a little monkey wrench, of course, thrown into us this afternoon. Did everybody see that?
Yes, he kind of threw a hand grenade into the crowd today.
Yes.
Marty, I apologize. I was with patients this afternoon. I have not caught up. Just finished my last one.
I missed the press conference today as well. So,
Marty, you want to update what he did?
Basically, the governor says that the state and the State Department of Education is very strict directives that all schools should be opening 5 days a week. So, and I have not, I'm sure Dr. Colbert's head's exploding right now. So I have not.
He wasn't given a heads up on that, as you might imagine.
He was not?
No.
Okay. So that being said, we can figure out what we want to do, but I'll just go over real quick. Can I share my screen?
Yes, should be able to.
Let's see here. All right. So I want to go over, hopefully everybody had a chance to look over this document. And it starts off with the key terms that we all know. And then it goes to the local data. I've updated what I had sent you earlier with the most up-to-date statistics that we have, that our 14-day rolling case average is now 16.6%. Our effective, according to Columbia University for Washington County, is now 0.51, which is excellent. So excited to see that number. It was 0.97 last week and 1.12 the week before. So trending down wonderfully. Our new cases per 10,000 population over the last 14 days is now down to 93.1. Again, trending down nicely. Fayetteville has had 123 new cases in the past 10,000 per 10,000 population for the past 7 days. ACI should be updating that any moment now, so that we're going to be able to do a 14-day statistic for Fayetteville. And the reason the 10,000 population per 14 days is important is that CIDRAP, the Center for Infectious Disease Research Analysis out of the University of Minnesota, has recommended that we use this statistic for a metropolitan of our size to make decisions on school opening and closing, and not use the percent positivity because we're testing such a select group with our PCRs. So this is going to be skewed high. So that's why I'm following that one, and hopefully we'll get an update here really shortly. Also added in some information about, interestingly, I wrote this Thursday, Friday of last week, and of course, like 5 new studies have come out about pediatric spread since then. So that I'm trying to add some data in, but one study shows the nasal carriage in young children to be even higher than that of adults. And that is 0 to 5, 5 to 17 is shown to be equal to adults. So kind of rewording the conclusion there, the relevant extent to which they pass the virus to other children and adults is still under debate. And we're still an area of active research, and very active research. Like, you can't even write anything because 2 days later it's obsolete. Then the other most important part of this is then the current status. Our R0 is 0.51. Our 14-day new cases is 93.1. And the University of Texas model suggests that any school that opens in Washington County with things as they are right now will have about a 1% of students will show up positive on the first day. So the question is, do we want to say anything more, like a recommendation, or do we just want to give them the statistics that we think that we're going to be opening in the yellow zone and this % of students are going to show up positive? So thoughts?
Marty, thanks for putting all that together. That's very impressive and thorough
Sure
and
is.
statistically
Disappointing.
I really appreciate you spending that time.
It's not clear to me that having the schools open 5 days a week is the same as mandating students be there 5 days a week. But clearly, I don't think we're in any position. We don't have the ability to social distance to open schools at this point.
No.
Steve was going to be here this afternoon. Did we hear back from Dr. Boss?
Media services forwarded the link to him, but I don't know. Aside from that, I don't get any response.
I'll shoot him a text. My question for Steve was going to be if in his model he could include the Israeli data when they reopened schools,
Yeah.
because they actually had followed the CDC recommendations just because it's science-based and their disastrous response. It would be interesting to overlay that to see what the modeling would predict, how soon we will hit that exponential growth part of the curve based on what they've already shown us you do when you enter it with low positivity rates and low public spread rates. There, hey, Steve? Steve?
Hi,
Oh,
how's everyone doing?
Doing great, Steve.
Good.
Marty just laid out data to show where we are and our likely number of kids that'll be positive on the first day of school if we go with what the governor recommended. My question for you was, is there a way with your modeling to take where Israel was when they opened their schools, which was a 14-day low positivity rate on their test, and project where we are with how soon it'll take us to explode based on their modeling?
I'd have to think about that.
Because they were about 6 weeks from the time they opened when they had 14 days of no.
And so what I would have, I think I could. I mean, what I'd have to do is go out and get the data on Israel's basically overall infection rates, which is available publicly. I can get that. That's easy enough to get that. And then I'd need to know something about what the population of school children they have is.
Mm-hmm.
How many people went back to school? So basically change the exposure rate for that number of people, I guess. And then just I can monkey around the model. I can see what I can do. I think I probably can do something like that. And I don't know. And so you just want to kind of know what the lag time might be from opening up to when we get a peak of some magnitude.
Right, and how different it will be based on how many more cases we have now as opposed to what they had when they opened.
Yeah, so, and that's going to be cases, you mean statewide?
Well, now, if we could do it for Fayetteville or at least Washington County.
Washington County, I can do pretty well because there's daily data for Washington. You know, the governor provides basically daily data for Washington County. The problem with Fayetteville is that the ADH is still only releasing these summary data at kind of 2-week intervals. And so we have basically for Fayetteville's cases, we have a cumulative total from July 9th and a cumulative total from July 20th. And that's the only 2 data points we have.
We actually have July 27th too.
Okay, so they've updated again today or yesterday.
Well, they updated last week, and I'm expecting another update within the next 24 hours.
Good.
I can look at that and, again, it's cumulative data. So you're trying to interpolate between data points what was really going on. And I can try and do that. Do we have a sense of what's our population of our students in our school district? Do we know that number? Just a rounded figure. Is it like 15,000 or 20,000 or?
It's like 10,000. I can get you the number. I'm getting.
Okay.
No.
Yeah, if you got that number, that I can do that, and I can do that. I can probably try to figure out something for Fayetteville from that.
I can also get the number for the ones that are actually planning on attending.
Yeah, and then I guess the other variable we have is what's the attendance model? Are they going to school like every other day? Are they going every day? Or half the schools virtual? And half the
you missed the governor's discussion, I guess, today that everybody has to go 5 days a week.
Okay, they've got to go 5 days a week, but they have to be face to face 5 days a week, or is it virtual for 2 days? And
no, in school 5 days a week.
Okay.
But the parents aren't going to do that, and they're not going to have the staff to do it, I don't think.
Yeah, well, it's not going to last anyway either. I think we all know where this is headed. Based on current experience, those schools aren't going to stay open for long.
That's why I was wondering if data could tell us, is it going to be 3 weeks or 6 weeks before it hit?
Yeah, if I was going to guess right now, I'd say it's going to be because they've already started football practices and things. It's not going to open at all. That'd be my guess. Like this outbreak's going to happen before they try to open on the 24th.
If it's okay with everybody, what I would like to do is take off any recommendations since everything's muddled, and just submit the data that we have to Dr. Colbert because he's been asking for it, and leave it at that for the moment until this.
If the board's consensus is that we have grave reservations about opening with the number of cases we have, the lack of testing and the lack of social distancing, I think we should be on record as saying this is dangerous. Nobody else?
And I would suggest too that you can cite, there's already emerging precedents around the country. Schools have already tried to open and they've already closed in different states already.
So I agree with Hershey. I mean, when they came out first about having just kind of this hybrid situation where you could actually minimize foot traffic in the schools, even that obviously is a concern. They're still going to be relatively crowded in the hallways and that type of a thing, but at least it's something hopeful moving forward. But then to actually fill the schools with full occupancy, institutes of higher ed aren't even doing that. I mean, we're offering hybrid choices and, again, trying to decrease foot traffic on our campuses. And you think about the size of the U of A campus compared to a local Fayetteville school, that's really worrisome. And I understand the need to have some on-site learning, I do, but there's got to be a compromise there in the middle. There just has to be.
Perhaps we can have a statement to the effect of, based on the current community-wide spread, we, anticipate outbreaks being the normal, or, outbreaks being common, and would like for the school to be, prepared to scale back to virtual learning in the event of this type of incident.
Yeah, if you'd like to, I had looked at a little bit of modeling just with the county level data the other day, and what I tried to model was the arrival of 20,000 college students here on August 21st. And I can show that model output for everybody if you want to look at it, because it was kind of interesting. The model actually did something that I wasn't really expecting it to do. I kind of expected there to be a really big spike, and then we'd come down off that spike. And rather, the tendency of the model was to increase to sort of a modest level of infection rates. So we went from about 50 or 60 per day in the county to about 100 per day. But that 100 per day caseload lasted for like four months or so. And so it just goes. So it's like a slow burn, basically. You get this constant level of infections that go on and on and on, and that assumes there'd be no mitigation that took place. after the students arrived.
But didn't your model reflect a college campus influx of 20,000 and not
Yeah.
15,000
That's exactly
in
right.
tiny classrooms?
That's
I think
exactly right. That
I think
was the
the
college
Israeli
students arriving.
modeling is much closer to what we're going to face, where you pack a bunch of kids in, you
Yeah.
don't have social distancing.
Right.
To be
Yeah.
honest, I mean, those of us too, that speaking as parents, you know, I mean, the hybrid model was appealing, you know, so they could be on site for some of their schooling, knowing that the classes would be smaller. There was some reassurance there, but now being faced with the prospect of, you know, having 30 kids in a small classroom, even if they're all required to wear their mask, I mean, they could be sitting within 2 feet of each other for an hour at a time, if not longer.
And
Like I said,
during meal times, of course, they will not have their mask on,
right.
and there still won't be socially distanced. So I saw the mandate from the governor. I didn't see any robust intervention in terms of rapid testing, school testing, sanitation support, allowing more rooms for meeting, for being with the students, and more staff for staffing the small density rooms. None of that was laid out. I just don't see any way that we're ready to do this in 2 weeks.
Well, why don't I draft a sentence to the effect, or that last paragraph to the effect, you know, while we are concerned about, you know, the schools opening, we do believe that the hybrid 2-day-a-week model would be the one we would prefer.
Absolutely.
And then I'll draft something and send it out to the board, and we can do an email vote tweak, and then I'll get it to Dr. Colbert just as soon as we can.
That probably needs to happen in the next 48 hours if it's
Yes.
possible.
Yeah, because he's expecting, he knows we're meeting tonight and he's anxious. So
Very good.
So let me ask a question. Does, so about if I remember right, about 15% of the student population was selecting 5-day-a-week virtual school. Is that totally off the table for them?
no, the governor wants a 5-day-a-week in-person option to be available.
Okay.
Oh, so it's 5 days in person or 5 days virtual?
Or you could have a hybrid, but I don't know what good that does you if you have kids there 5 days a week. Like, that doesn't help with the social distancing.
Exactly.
I see. Okay. So gotcha.
And yeah, Lenny's right. I mean, the majority of people wanted the hybrid model. It would
Yep.
be interesting now if you polled the parents what they would choose to do.
Yeah, I mean, we did not have the option for 5-day in-school classes. And the fact that we are faced with that at this late date, there's just no way to prepare for it.
Mm-hmm.
Okay, I will work on that.
And the question is, can the city do something? And this gets to the executive and legislative functions that we have nothing to do with. We're just recommendations. Can the city do something about enforcing social distancing in each classroom and on buses?
I don't think we can. The school board is basically at the same level of local government as the city council.
Okay.
And both of us are supposed to follow the dictates of the governor when he does a proclamation about this kind of stuff. I mean, the city council can't say, just ignore the governor's proclamation, or they can say that, but it won't have any force and effect. I think your advice to the school district is very warranted. I know if I was a parent, my kids wouldn't be going. I'm very shocked that he has come forward with that. But it's not something I think that the city council can step in and say, well, just you all don't have to follow what the governor says.
But as subject matter experts in an advisory capacity, it seems to me we're forced to issue the best advice we have, which is at best a hybrid solution is what we ought to go for.
Absolutely. You can give the advice you think is the best medical advice on this. And unfortunately, I don't know if the school district can follow it, but I still think it's good for you all to give that kind of advice.
I agree. I agree. We can't go on the record that we agree with filling the schools to capacity during a COVID-19 pandemic. That would be we can't do that. So our medical credibility is on the line too. So
Exactly. And can we, that's an interesting Huda discussion of what is capacity. Is capacity 10 kids, a teacher and an aide in a classroom, or is capacity what we're dealing with last year, 25 to 30 students? And I think really the school board's position is that it's social distancing is their capacity.
Yeah, the capacity should be what complies with the CDC outline that came out, right? They had guidelines about spacing in classrooms. That should be the capacity.
But the governor didn't reflect that today.
Right. Yeah.
Hey, Brad, what is y'all's responsibility in terms of public health and overfilling a room? I mean, you can certainly address bars and restaurants. Can you not address classrooms?
I honestly don't know the answer to that. I mean, I know that exactly what you said. I know that we can do it with restaurants, we can do it with bars, but we're also doing it at the behest of the directives set out by the governor and the state laws adopted by the state. If his directive doesn't indicate that we should do that, we really don't have the ability to enforce it. I don't believe. Kit might be able to.
I would assume you have specific laws saying, this size place has a fire code capacity for this many people, but I doubt we have COVID codes for a classroom.
Capacity.
Well, that we've been addressing this on UA's campus as far as the ADH has guidelines regarding approval necessary for groups past a certain number. And so when you think about the possibility of having hundreds of children in a cafeteria eating with no mask on and not physically distancing, I can't imagine that's an approval there. I just can't imagine that would be the case.
Well, how the governor could say restaurants have to be at a certain capacity.
Right.
Don't.
Right. I mean, that's the comparison there. It's like, it's no different. And then from what Marty shared as far as, the carriage rate of the virus, especially in the younger children, and the risk, obviously to possibly more vulnerable population like the teachers or other staff members working within the school. And that's just in the elementary schools.
There was a study out of Australia, again, late breaking, not included in my report, that in Australia, they were seeing child-to-child transmission of 0.3%, child to staff of 1%, staff to staff 4.4%, and staff to child 1.5%. So, the more kids you have in there, the more staff you got to have. That's putting your staff at greater risk.
A lot of our staff in Fayetteville is high risk population.
I think one thing that's important for us to focus on is that it does seem like we're going forward with kids there 5 days a week. And so we need to make sure that, I think in our report, we're saying directing the school to have as much cohorting as possible, as much social distancing as possible within this 5 day a week schedule. Because I think it's important for us to go on record that, 5 days a week, 100% capacity is going to put things at high risk of spread. However, it does look like that's how we're going forward. I mean, that seems to be Arkansas's directive, that we're opening things back up and we want parents to work 5 days a week. And then so parents need their kids to be at school 5 days a week if they're to be working.
But how do we crash land this plane, Gary? I mean, the governor can't mandate that when we hit this exponential peak that we keep the kids there, can he? Parents won't stand for it.
Do we have a county health department that has any authority to declare like a public health emergency or anything like that?
Washington County
We did that
Health
as a
Unit.
city.
Yeah, well, the Washington County Health Unit falls under the Arkansas Department of Health. So,
Do you think it would be worthwhile to, for maybe the board to send something to the governor asking that he define, exactly what occupancy is? I mean, or how he's going about it? Is it going to be based on, like you said, the previous rules of, however many students per teacher, or is it going to be based on, the same guidance that we see in restaurants? I don't know.
I'd say sometimes it's better not to have it exactly spelled out because it might give you a little more leeway, or the school district more leeway if he's being unclear. I think one thing that y'all might want to talk about when you make your recommendations to school is really address the lunchroom situation, which to me seems like to be the most dangerous of all the activities, maybe encouraging them to eat outside or something like that. But that would be my recommendation, that you try to focus on what's actually going to be the most dangerous for the children. And
You have half the kids eat in classrooms and half the kids eat in the cafeteria.
That's their plan right now, or it was.
In gyms and auditoriums.
so will they also, the possibility then is to stop migratory classes, maybe have the teachers rotate instead of the classes rotate, because it would make the contact investigation a lot less complicated.
Absolutely.
I talked to Dr. Colbert about that last week, and he certainly wants to do that in the elementary schools. It does get complicated once you start reaching high school, where you've got a kid that may be in AP Science, but then in regular English.
Right.
And so very difficult to cohort once you start getting to that very level. Or going from PE to AP versus regular English, it really gets difficult.
And with the different transmission rate and different curriculum and student needs, it would make more sense to allow the freedom for high school and maybe middle school, or maybe junior high and high school, to do virtual or hybrid, and use those spaces to spread out some of the middle school and elementary school students to those other facilities.
These campuses, yeah.
Well, like I said, we've got a hard stop. Marty, do you feel like you can craft something that expresses these concerns and share the data? And I would probably, in addition to sending it to John L., copy the governor and the education department folks in Little Rock, because I assume he's listening to them.
Well, let me get something crafted. I'll probably get it out to you. This is going to be sometime tomorrow. And then we'll tweak it and get it out to whoever we feel needs to see it.
Super. And before we get off schools, Brad, I've had some questions from teachers who were planning on partitions in the cluster desk like we see at restaurants and the grocery stores. And some of the folks are being told that represents an ingress, egress, or fire hazard, and that y'all won't allow partitions. Is that right?
I have not fielded that question directly. I can certainly follow up with our fire marshal.
That would be great, because I can't imagine that we couldn't have partitions between kids' desks, particularly those that are clustered in 4 seating units. And that might be something that we need to post once we get the answer to that, to allow the teachers the flexibility of making their spaces as safe as they can. The other question I had, and Marty, this, you might already know the research. Several teachers have been on the interwebs and found a little plug-in virus snatchers or something. God knows only what's available out there. But the question is there anything that could be used in a classroom like we do UV lights and TB rooms or something that would be helpful? And if not, we need to put that information out there that your $29.99 that you just spent at Amazon, not only can you probably not use it in a classroom, but it's not beneficial. Are you aware of anything for single room sterilization?
We're in a community clinic across our sites. We're installing mobile HEPA filters that, and there's probably, one per every kind of classroom type size. They're not cheap. I think they're $2,500 a pop.
Yeah, that's different than these $20, $30, $40 units that are being.
And they kind of are dual active. I don't know all the science behind them, but it sounds like they obviously bring in air that goes through the HEPA filter and then emit an ionized air that supposedly also has an effect on the virus. But they're quite nice. They've gone in our Springdale location. Kind of the difference in drinking tap water and mineral water, you notice an air quality difference. They're quite impressive. But that would take a lot to cover our schools.
Yeah, I don't see the school district dumping a few $1 million on those units for every classroom.
For 6 months of use, or hopefully 6 months.
Yeah. Or 6 weeks when we have to shut down. So that's fire marshal question, filter question. We don't think anything they're going to order online will be a benefit. And then we'll state our healthcare position as an advisory board. And that gets us to testing. The governor is making testing more robust, but through the county health department, which doesn't do us any good at all on schools. Do we not think we need rapid testing at schools at each nurse's station?
Can I speak to that a little bit, Hershey?
Okay.
So there's a lot of, there's a lot out in the news today about, over the last several days, about the rapid antigen testing for COVID-19 and folks kind of clamoring to get machines. So while the machines may very well be available, we haven't gotten one yet at the U of A, by the way, but we're still trying to petition for one. The test kits continue to be in short supply nationwide. So one of those situations where if you've got the machine, that's grand, but if you don't have test kits, it's not really going to do you a lot of good. And then if we be careful about the type of testing that we're doing. So a lot of these rapid antigen tests, they have their place. A positive result means something. A positive's pretty reliable result. But there's a lot of false negatives. I mean, you can't really use it to test asymptomatic people that might be carriers. It's still PCR screening, which still takes at least a couple of days to get results.
There's a coalition of 7 states that are going together and buying these up, and they're going to get every test kit there is. I mean, I have the rapid in my clinic, and I was just told, order all the tests you can right now because you're cut off.
Right.
So we're going to be flying blind pretty quickly.
We're kind of flying blind right now. Speaking of the tests, the state is not reporting the antigen test. I did a quick survey. It looks like there was about 3,800 to 4,000. I put this in an email. Rapid tests done in Washington County in July, with about a 20% case positivity rate from what I could gather. So there's several hundred cases from July that are not in our numbers. And none of those that governor seems to think magically they all went and got a PCR test and waited for 10 days for those results. Not maybe 5% of those did, maybe.
Well, that was going to be my question. Do we have any idea how many got their backup test?
Very, very few. I know that Manna did a few initially just to see how reliable the Sophia Quidel tests were, found they were pretty reliable, stopped doing them. I know that, pardon me, same thing with Northwest and same thing with Karis. And actually the rapid that's what they're using at what Dr. Karis is doing at the county jail. So that's what they're screening there.
Yeah,
and those are
sent. And Marty, you may have already answered this because my question really, and I can't seem to get an answer for this question is, you're hearing all these other states. For us, we hear things about other campuses in the SEC and things along that line, that there are these grand plans of testing their entire campus, tens of thousands of people. And The assumption is they're using the rapid testing. And so the question is, how are they getting all of these tests? Or, some of the other things that we're reading about is people that are having these home kits. And, I know that some of the commercial labs have been talking about having home kits available, but we haven't seen any of that happen in our state either. And so, I don't know what the answer is. I mean, why are some of these other areas in our country seeming to have access? It seems like tens of thousands of tests, and we're so limited in our state. And I can't seem to get an answer for that question. So
there seems to be some of the home kits in the state. We have had some patients say that they received some from the Department of Health, but don't have any more than that kind of here in that second hand.
I see.
Doesn't seem to be particularly widespread. The other difficulty with some of these rapid tests is they're very specific on when they should be used. I understand they're using the Sophia in the prison system for rapid testing, but really they are meant to be for symptomatic patients, not for exposure risk. And then you're really, I think, day 5 is when you're supposed to use the rapid tests. Sophia is unique, and it's the one right now with the kind of emergency guidance that right now does not require a backup PCR.
You're
Two
muted.
questions that seem to go fairly well together are the city youth sports, parks, and then the overlay of that. Should part of our school discussion be we don't recommend high-risk activities like contact sports in the schools or choir as the school part of the discussion, and then for the city parks part of the discussion and our local K through 12 schools, should we go on record as saying we should not in the fall semester engage in any contact sports? I don't see a safe way to do that, but what is y'all's thinking?
The governor's press conference today talked about contact sports. I think they have guidance on that in choirs and band as well. He didn't go into a lot of detail, and when I tried to look for any kind of commentary on it, I couldn't find anything.
I know that the ADH committee looking into fall contact sports and their guidance for it was meeting today. So I don't think that that's been published, but the governor did say this something for choir and band was, I haven't had a chance to even go look for it. Was published. I haven't seen it.
I think
my understanding is, the practices for contact sports have already started this week.
Which doesn't mean it's the correct thing to do, clearly.
No, it's not. But there are restrictions about the band, having kids in the band. So I know that there are already restrictions on them right now as far as not playing their instruments for obvious reasons, the same reasons for choir, not singing in a big, having 50 people singing in a room. So I know that our band directors are being really strict and stringent as far as that go. And they haven't had any practices yet. If they do practice, they'll be practicing outside without instruments, maintaining at least 6 feet of distance between each other on the football field. These are all things that we continue to be updated on a weekly basis.
And band and choir can do that. I don't see how football can.
Nope.
They haven't started contact. They're still doing contactless drills until this guidance comes out from ADH. But supposedly there's going to be guidance that lets them in some form. I don't know.
So what about city parks? If there was a way to sterilize, disinfect, and maintain social distancing, it seems like that would be a good way to get kids out, but I haven't seen a model with limited resources that makes that a possibility.
I haven't seen any data, so I have a hard time making anything except for being outside's good, sunshine's good.
That's what I was about to say. Yeah, sometimes good if it's not too hot, or I mean the weather is limited. I mean, obviously there's limitations there too.
Well, I'm going to chime in just a little bit on some of that, because right now I'm getting a lot of requests from parents to do baseball for 9 and under, and then to open up the playgrounds. And I really wanted to get the opinion of the City Board of Health before I went down the path of just opening everything back up. I do see some openings with some sort of restrictions, and that's why I'm bringing that forward today. I know I've got a couple of staffers that are here, Vine Humphreys and Lee Farmer, that can probably maybe give you a little information on exactly what they're doing and what of some of the asks of the parents are right now. So I've got Lee, you or Byron want to?
Mayor,
Yes.
baseball for 10 and up is already resumed.
Yes.
Okay.
And we've done a really good job because we're doing the social distancing and folks are wearing masks. Now, I'm not saying we're 100%, but it's going pretty well. But, my concern is there's a difference between, kids 10 and up and maybe children that are 9 and younger, and you might not always be able to keep a mask on. I mean, I know that the governor has said that they don't have to wear a mask, if I understand correctly. So
the kids aren't in the dugouts?
There's supposed to be social distancing. I've got some staff here, and they have not.
I'm here, Mayor. Can you hear me? It's
Yes,
Byron.
I can. Yes, Byron, you want to tell them what we're doing on that?
Yes, sir. So the request for baseball in the spring, we played baseball for ages 9 and up, and we had a set of criteria with the social distancing, sanitizing. We blocked off bleachers and restricted where fans could sit and that type of thing. And they're just winding down that season this week, and by all accounts, it was successful. We had no reports of any conflicts or illnesses that we're aware of. And so they're wanting to offer for the fall season also, partly afraid that some of the contact sports might not happen. And so trying to allow them to play a non-contact sport in baseball. But because the age groups of 4 to 8 did not get to play, they were wanting to also offer that age group following the same restrictions that we had in the spring that seemed to be successful. And so that's kind of where we are. They were taking temperature checks of coaches. They had hand sanitizer, sanitizing equipment, taking all the steps. We got the plan approved with the health department. They approved the protocol. So that's kind of the request now, is to allow the younger age groups also to play.
And I wanted to bring it to you all because I wanted to get your input on this before, I just suddenly opened that up.
What were the dates that those baseball games were being played? Were they being played currently, or was that like earlier in the spring?
The last week is this week. So there's actually the last round of games at Kessler are tonight. So they started the 1st of July. So basically they played the month of July, and they played 2 nights a week. And so they also limited their game schedules. So they were trying to play double headers against the same teams and not, trying to organize the game so there wasn't a lot of cross contamination with fans and people coming and going.
And the reason I'm interested in this, a lot of that is non-contact sports, and I think it's good for the kids to get outside and be able to do some sort of sports activity, but I don't want to create some sort of health issue in doing that as well. So what do you all think?
My initial reaction is that, this age group, even though they have a harder time wearing masks and they have a harder time social distancing, that they're outside, they would be the safer group versus the older ones as far as transmission. So my initial reaction would be that, if the older ones are allowed to, that they should be as well. But
That makes sense. What about soccer?
Soccer, we have not allowed. That's considered a contact sport by the governor, and we're still waiting for more guidelines from the governor's office.
Right.
Okay.
Marty, I tend to agree with you. I have a tough time with, I didn't realize they're playing baseball at 4. It seems like that's a group that would be a lot more difficult to keep in compliance. I would think that most 7 and 8-year-olds, though, could follow similar compliance rules that a 9-year-old can.
So as a recommendation from the board, give it a try, and if it goes as well with the younger kids as it did with the older group, carry on till we got data to suggest it's not.
Yeah, that's and I agree with you, Hershey. That's where I kind of wanted to start. And if it goes well, then we'll continue to do it. And if it goes badly, then I will close it down.
Good idea. Could we get a list of the evenings when that's happening? So maybe some of the health board could just swing by and take a look at it in implementation.
Sure. Byron, I'm sure you have that, don't you?
Yes, well, they're kind of waiting for the decision here tonight before the fall season, but the spring season is finishing up tonight. So if you had time to jump out there tonight, you could catch the final games.
In terms of risk of severity of illness, in terms of risk of contagiousness that we know, which is all, like Marty has highlighted well, basically we don't know. I don't think this younger group is any more significant risk than our 9-year-olds or our 15-year-olds.
I agree.
Okay. So I'm assuming y'all are okay.
Sounds like we're okay with that. That in terms of the ability to sanitize and social distance at the parks, what's the thought about that? I mean, because you have the same sort of parameters that you're having with baseball and letting kids go to the park and slide and run and play out there.
Wings seem pretty reasonable to me to, have those open. Gosh, I would love to open parks just selfishly.
Why don't we fit some guidelines for that and give it a try?
Yeah, I agree.
Perhaps, I mean, I don't know the cost of all this, all the different parks, but just with some sort of educational piece, proceed with your own, social distancing and understand that and understandable risk by being at a park with other people. If we could have anything like that, I think that would be excellent.
I'll make it work.
Mr. Mayor, are the bathrooms still closed along the trail? I know that's been a question, especially in the running community, having those opened back up.
Yes, sorry, Mayor. The only restroom that's open is at Walker Park. We've not opened any of the restrooms yet, kind of waiting for further guidance. We have opened drinking fountains. There's 5 or 6 open along the trail, and we can sanitize those 2-3 times a day. But one of the questions we have as far as opening playgrounds or restrooms would be the sanitizing requirement and the frequency of that, because we can clean and sanitize them once a day pretty easily, but if you feel like it requires a lot more than that, that's when it gets difficult with our current manpower.
Well, and you would think the users of the facility would be able to have their own sanitizer and be take some sorts of responsibility for that.
That's my thought, Hershey, is if we have some sort of educational piece of there's an understandable risk by participating, at the park right now. Please practice social distancing and assume your own hygiene technique or, some sort of verbiage there.
No, go ahead.
No.
I'm curious how I'm going to manage that exactly.
No, I mean, I agree. I mean, if we can't clean the bathrooms more than once a day, then they need to remain closed. Because then you can't control traffic in and out of there overnight. You can't control traffic in and out of there. I said that would just, I don't think that that's a good idea. And I would love nothing more than to agree about relying on people to do the right thing. But that's likely not going to happen. So, you know, I would not open those bathrooms unless you could clean them more often. So
Could we open the water fountains at the playgrounds? So at least to have a way to wash hands with some water. I don't know.
We could. We have some of those open now. They're much easier to sanitize. It's,
Yeah.
you know, they're so small. It's a quick, it's just getting to them that takes the time. But as far as the playgrounds too, is because some of those things that I've seen from the CDC is the UV either breaks it down or they don't feel like the surfaces is the main vector. So with playgrounds, would we need to sanitize those, or would, it's another question we had.
I would need to look into that and read the CDC guidelines. My inclination is what we're learning about foam mite spread is, you know, not nearly as scary as it was initially. And, you know, the sunshine being the best disinfectant still exists. But I need to look into that a little bit more in depth before making a recommendation on that.
And I think the education is key. If parents had some wipes or sanitizer, they could take part in that as well.
Okay. So we want to we're not going to open up, you don't recommend I open up the playgrounds right now or the bathrooms.
Well, I thought the playgrounds we thought would be acceptable.
Okay.
yeah, I think the playground's fine, but I'm
Okay.
not sure about the bathrooms.
Yeah.
Yeah.
But if we could do a twice a day, do you think that would be adequate? And then educating the users to sanitize, wipes, that sort of thing? Or would you think every hour, every 2 hours? What would be your bar?
Byron, you want to try and answer that?
What are you talking about now, Hershey, sanitizing which one?
The bathrooms, if we could target the bathrooms down at, you know, like Gordon Long, some of the high use. Where did you say?
We might could select a couple of the high use ones and add that, and we shoot for 2 to 3 times a day. It's what we're shooting for Walker Park. So if we were limiting it to 1 or 2 more, we could probably handle that with our manpower, but we couldn't open all of them and sanitize it that frequently.
What do you think about some targeted high use spread out bathrooms?
That's a possibility. You know, I mean, it's my concern, you know, that I don't know what the normal policy is as far as the bathrooms go, Mayor. I mean, are they typically locked at night? I mean, during a normal non-pandemic time, or do they remain open 24/7?
They're open 24/7.
Yeah.
So I guess the concern that I have is what might happen overnight as far as someone could potentially sleep in there. I mean, they could. I mean,
they do.
They do, right?
Yeah.
So it's those types of, I guess, scenarios that really concern me as far as the cleanliness during a pandemic situation.
Well, what about limited hours to be open?
That would work better. Like if it was only open during like daytime hours where you're going to have family and children there playing in the parks, that type of a thing, but maybe not open overnight, and then have increased frequency of cleaning during that time.
Byron, do y'all have the person power to open and close 2 or 3 extra bathrooms?
It is a challenge. Actually, the one at Walker that's open, we do lock it at night, and the police help us with that. They lock it at night, and then we unlock it in the morning when we start. So we could probably work out an arrangement for another couple.
When do you open it? Because a lot of the runners around Gordon Long are going to be out there at like 5 in the morning with the heat.
Yeah, that's the challenge. Our crews start at 6, and so it would be 6 or just a little after before we could open it.
And if people knew that, then they could start their run and not hit that 6.
Right.
Right. Absolutely.
I mean, I think Gordon Long would be the one to target for next reopening. And then maybe look at Wilson later if this is successful. But it's just that side of the trail system, there's not anything really. And I know that there's use of, people are going in the woods. That's not necessarily safe either.
Yeah, the Lake Fit or the Veterans Park restrooms, that seems like a pretty high use area as well. There's a lot of people that go running from there in the morning too.
Right.
I think probably my concern of the bathrooms would probably be more on ventilation than maybe even surface cleaning. And so in terms of bathrooms that I would feel most comfortable of opening would be ones that have multiple windows and door that can be propped open without exposure of restroom use. I don't know how to say that best. But knowing that this is a respiratory illness and knowing that the fomites are a little bit lower concern than the respiratory secretions, I would think if we spotlight some that have particularly good ventilation, that would really increase my comfort in opening those.
I agree. So, Byron, then the suggestion would be to see if you can open a couple of bathrooms or come up with a plan for one here in the next week or so.
Okay, we can put together a plan for the mayor, see what he thinks, and ones that have ventilation are easy to open up.
I think we're going to need to meet again next Wednesday because we have a lot of things left hanging we need to address. And DeAndre, I am sorry I thought we'd have you in on the discussion. Another non-pandemic issue we need to address is the healthcare disparities based on systemic racism. Do you want to talk about the council's recommendations and findings?
Absolutely. Thank you so much for allowing me to be a part of this conversation. Hershey, again, thank you. I've learned so much by just sitting in and listening. And real short, the Fayetteville African American Advisory Council, we've been looking at this information at this data since last year when Wisconsin was the first city, the first state to actually do this. And so we've been having conversation since last summer, and the very first conversation was with at St. Paul's. And we've done research, we've looked, we've done more research, and we feel that after what happened with George Floyd, we feel that after that incident, and of course getting the information and various African Americans telling of our experiences, we feel that Fayetteville, that we wanted to present this to the Fayetteville City Council, to Mayor Jordan and the council, and we feel that it is time that this is the appropriate time for Fayetteville to look at how they can, as a city, as a community, how can we address systemic racism. And it's the information, I believe that there are over 100 articles that definitely speak to how racism has impacted and continues to impact the physical and emotional growth of African Americans in almost every stage of life. And I do believe that COVID-19, I often say this, a pandemic doesn't discriminate, but however, the United States, our history, our country has proven to do just that. And so we want to, again, for Fayetteville to take a look into Mayor Jordan's resolution, looking at this will bring awareness, but also to what we're hoping that the city will be able to put something in place to address this epidemic.
So I know that from the African American Advisory Committee, I know DeAndre and I have worked on this, and so has the police department and staff. I know the city attorney's been involved on what we can do and on the legal aspect of it. And everybody's worked together on this for about, I'd say a couple of months, right? Actually, Garner, it's going back a little further than that, but I'm saying, we became aware of this probably, 3-4 months ago, maybe 6 months ago. We began to work on something along this line. So that would be something I would sponsor to the city council, and that we just take it from there. But I wanted y'all's input because it says that racism is a public health crisis, and I thought what better place to take it than would be to the city health board. So that's kind of where we are. That will be. This also mirrors something that we're working on my National League of Cities committee. That is a national resolution that lines up very similar to this. So that's what I have. DeAndre's done some fantastic work on this. And as we always say, at the end of the day, we're all working together on stuff. So I'm bringing it to you all.
Yeah. We definitely welcome that discussion for sure. Just talking about, and obviously you're right, about a public health crisis and talking about disparities of care and access to resources. And so it deserves to have that type of attention to it and for us to discuss it. So.
The bibliography was impressive in terms of the data that supports that. I think the policies you implement to address those disparities, that's a much more complex issue, but from a health board standpoint, it's clear that it is a health crisis.
Agreed.
So we're all agreed that it is a health crisis, correct?
Yes.
Thank you.
Yes. And hopefully media services will be pleased we're not bumping their hard stop line. Any other comments from board members?
Hey, Hershey, I wanted to circle back on the partitions. Our fire marshals have not been contacted, and they said they'd be happy to work with them. So if whoever you've been speaking with, if they'd reach out to us, we'll do our best to come up with a good solution.
I will do that. You know how the rumor mill is.
Yeah.
Somebody said, they said we.
I'm very familiar with that.
Any media services, any comments you notice out there, any suggestions, comments from board members?
We have a few people with their hands raised. Do you want me to allow them to talk?
We've got about 5 minutes or so. So if the board has nothing else, you want to see what folks are thinking about?
Hershey, I'll just say real quickly, Jennifer Dillahay has asked me to be a part of the Arkansas Vaccine Council, Medical Advisory Council or something like that. And so we're going to be taking on the COVID vaccine discussions. And so hopefully that'll transition well to this group, and I'll try to keep everybody up to date with what I learned from there.
Well, that's great.
And Dr. Garner, just a word from Washington Regional and all the Northwest Arkansas hospitals is we're down to 54 total admissions in all Northwest Arkansas hospitals, and regional's numbers are also at the lowest point they've been since mid-May. And so we're seeing, really all the data points now are the trend is lowering. So we are seeing lower numbers across the board, which is some good news today.
Lenny, enjoy the break.
Yeah.
Prepare for the onslaught that's coming.
Yep. That's and we are. We see what's coming here probably as early as mid-September. So.
And Hershey, I have
yes.
2 items that I just want people to start thinking about for next week that I'm going to ask to be put on the agenda. One is looking at the coroner's report and the deaths in Fayetteville trending to be coming out of nursing homes, in particular Fayetteville Health and Rehab. And I'm going to be reaching out to the coroner to discuss with that more with him specifically. And then also need to start branching and widening our thoughts to the mental health aspects of the pandemic that I don't believe this, looking back through the minutes, I don't believe we've even begun to start addressing, and makes my head explode even trying to think about it. But those two items, if everybody could start thinking about to discuss next week.
We'll get those on the agenda. Any other questions or observations, anything from attendees?
Oh, I've got Michael Ferguson that has his hand up. I can allow them to talk. I'll do that right now.
Thank you.
Okay.
Hey, thank you all very much for your time today. I'm part of the FYB, the Fayetteville Youth Baseball Board, and we kind of put together our recommendations for the summer. I think that went very well. As Byron said, the mayor threw the first pitch out. I thought that had an excellent night that night. He threw a strike too with that, by the way. So, but we've had a great summer. We went 5 weeks. We played anywhere from 2 to 3 games a week per team. And, you know, from what my knowledge from all the coaches, all the board members, we have not had any cases reported to us from any player or team. The only thing that we've lost kids from is from summer camps or vacations. My plan is for y'all's report is to run the 5s and 6s together, 7 and 8s together, 9s and 10s, 11s and 12s, and then 13 through 15. We're going to play all at Kessler Park. We're not going to open up White Walker at this time. We have a good handle on Kessler of how to sanitize. I have a bunch of hand sanitizer stations that we bought for the park, spread out through the park. We have a cleaning crew that comes in every night that we play and cleans the bathrooms for us in between each game and cleans every dugout in between each game. So, you know, therefore that's the precautions that we're going through. So for the fall, if we get it open, we will do that and try to spread those age groups out throughout the week and play, you know, no more than 2 fields a night or 3 fields a night throughout the entire, you know, 5 to 6 week season that we have.
Great. Michael, how many kids were involved in the summer program?
We had about 233 out of 800 that signed up, but 3/4 of our age groups are 4 through 8 that did not get to play.
So are you anticipating 800 kids for the fall?
No, sir. I anticipate probably right around about 200 to 300 kids in my estimation.
Michael, how do y'all do dugouts? I think that's my biggest area of concern.
So my team is a 11 and 12-year-old team. There is poles that are 10 feet apart. So each one of my kids is assigned in between each pole. So I spread out my kids all the way through the bullpen. So I have 12 kids on my team. So each kid has a 10-foot spot that they are supposed to stay in, put their bags in, their bats in. And then if they come into the dugout as a group, they are required to have a mask in their back pocket, and they put that on. But typically I have a coach that stays in the dugout or in that vicinity, and they spread them out throughout the entire bullpen area all the way down. So I try not to congregate any kids together at a time. We do not shake hands with the other team after the game. We tip our hats to them. There's no coaches meeting. So we do keep them all spread out. When you do have a team meeting, it is everybody's at least 6 foot apart.
Yeah, I would say if we could make that part of the policy for the league, just to have some sort of consistency, I feel pretty comfortable about that. That sounds like that's a great plan in terms of ways to space kiddos out.
Yes, that's in our guidelines that we have.
Thanks. And when coaches argue with the umps, with the referees during masks?
Yeah.
Well, they don't do that, do they?
Typically, we only put one umpire per game this year just to try to eliminate some umpire contact, since we use high school kids and young college kids. So we hadn't had any very issues. We've been very laid back. We're not keeping standings or scoring or playing for trophies, just because all we're happy to do is be able to play baseball. We've lost quite a few kids to other cities that want to play and travel teams. So hopefully to pull, if we do able to offer, 5 through 15, we can pull some of those kids back to our city to play versus going to play in Springdale, Rogers, or our travel ball. But we've not had any confrontations this year whatsoever, very much.
Thanks.
That's great. We're getting on our hard stop. Any other board comments?
There is one additional person that has their hand up if you want. Up to you, David Freeman.
Okay, well, we can take a quick question.
Okay.
I appreciate that, Chief Hardin. I have a comment and then a question that I'd like to add to. Mostly in regard to item 6 about the African American Advisory Council's proposition. Y'all mentioned that this was a very welcome conversation, and I just wanted to point out, like, what I noticed throughout the whole meeting was there wasn't a single mention of racial injustice and inequality, even as we were talking about decisions about the school board or about the public schools and about public parks. And we know that racial injustice plays out in how those systems are structured. And so I know that, like, it can be significant to have these conversations be welcome. And I would also like to see there be another step taken to bring these issues into the conversations that are being had. Because as a resident watching this conversation unfold, it was disappointing to see how it didn't seem like these considerations about what to do in our public school system actually took into consideration the different class and racial inequities that are at play. And so that's a comment that I just wanted to point out in response to something that was said, to the point that DeAndre raised. And additionally, I have a question. In 2018, the American Public Health Association published a report about law enforcement violence as a public health issue. And I know this isn't explicitly a matter of racial inequality, right? It spans into many other dimensions of oppression. It is still relevant to this current conversation about racial inequality and the killing of George Floyd and many others. And so I'm curious if this report came out in 2018, and I don't know much about the American Public Health Association. I'm not a medical professional, and so I don't know how y'all hold that association in regard, but seeing if that declaration of law enforcement violence as a public health issue could be something that opens up more conversation in the city of Fayetteville. This is very relevant currently in decisions that we're making about our law enforcement. And I thought that this was a very relevant framing to bring it up to our Board of Health. So I appreciate y'all hearing what I had to say and taking a little bit of extra time to listen.
David, thank you for your input. We have discussed in 2 previous meetings the vulnerable populations that are affected by school closings. So that is on our radar and top of mind. For me, those are the folks that we need to have the ability to have there more frequently. But we sort of got this information in the governor's press conference this afternoon that we were going from our hybrid plan to a 5-day full availability plan. So that kind of blew everything up we had been talking about. So we're having to react on the fly to that. But our vulnerable populations are key to this discussion. Any other board comments on that sensitivity?
Yeah, I mean, it can't be talked about enough. I mean, I think that could be something that we could and would love to spend our entire hour on. I agree, Hershey. It I think kind of got overshadowed by that kind of being dropped on us an hour ago or 2 hours ago. But yeah, I think from the get-go, multiple of us said in our very first is one of our goals is that we need to look at this and how our different socioeconomic groups and our different racial groups need to be supported by our policies. But I think I can speak for all of us that is a very high priority for each of us.
Absolutely. Well, we're at our hard stop time. Thank y'all. We covered a lot of ground. The council and the mayor have a lot of work to do, as does the chief and our park services. We'll meet next Wednesday, same time, new agenda items, and we'll have an email from Marty in the next 36 hours or so to look at.
Yes.
Appreciate y'all.